CPC, SDS, AMS Prep Session 21 Radiology Medical Coding. So I hope you guys are having the CPT book with you. Kindly use your CPT book and answer the questions. Hi Satyababu, good evening. Yeah. We have started with session 1. Today's session is session 21. So we have completed 21 sessions, 20 sessions. So those are available on YouTube. You can watch whenever you have enough time. So guys, these questions you need to read and you need to answer. Afterwards, we will discuss the answer. So I mean, in CPC exam, you need to read the question and you need to find the answer. We will follow the same way here also. So now it is 9:17. So we will start discussing the answer at 9:21. So I will give you 3 minutes. So try to find the answer here. So today's sessions are that much difficult. So you can do easily. Yeah, write your answer in the chat box so that we can discuss. So you have 2 more minutes to write the answer. Yeah, good Parmila, good try. Mamata, good try. Good Srinath. So no worries. Whatever you know, just write in the chat box. So no need to worry about the answer. I will explain you clearly why that is the answer and what is the procedure when we code in the live coding also. So basically our session is useful for the people who are writing the CPC exam and also the people who are currently working in the SDS or ambulatory surgery coding. So our intention is to help the coders and learn myself. You no need to worry about the answer. Good evening, Rajiv. So now it is 9:21. We can discuss the answer. So our first option is 77065. So first we will read the question, then we can decide. So a 36-year-old female is having bilateral mammogram. So this is the keyword here with computer aid detection. This is also one keyword conducted as a screening. So this is also one important keyword in radiology because the patient has had previous cyst in the right breast. So this is also one keyword. So what radiological services are reported? So basically we have two types of tests. One is diagnostic, one is screening. So usually physician will perform diagnostic testing for the people who is having the current symptoms. So but based on our scenario, patient has previously cyst in the right breast, not currently. So we need to consider it as screening. So as patient does not have any cyst now, so we need to check the screening codes. And here it is laterality plays very important role in radiology. So here bilateral mammogram. So we will check 77065. So what is 77065? 77065 is diagnostic mammography. So it is completely wrong as ours is screening. So as usual, B is also wrong. And we will check 77066. So 77066 is bilateral, but laterality is correct. But the thing is that 66 is related to diagnostic mammogram. But based on our scenario, patient has screening mammogram. So here our code is 77067. If you see the description of 67, screening mammography bilateral two-view study of each breast, including computer-aided detection. So because of this rationale, our answer is 77067. I hope you guys got this answer, but anyway, no worries. Most of the guys wrote correct answer only. No need to worry. So try for this one. Yeah, Parimala, you need to take care. So don't get hurry. Just compare the question with our CPT code description. That's enough. So now it is 9:23. We will discuss the answer at 9:27. 7 or 6. So based on the reply in the chat box. So you guys no need to worry about the answer. I will explain you clearly if you are wrong also. Just you need to have a determination of learning coding. So that is the main thing here. Good, Srinath. Keep it up. See guys, so anyone can write the answer, but the thing is that we need to know the rationale. That is very important in coding. Yeah, no problem. No problem, Parimala. I know about you. No need to worry. Just I am guiding you. Take care. So if you're writing online exam also, that might be the problem. Yeah, no worries, Srinath. So we can discuss soon. So we have sufficient answers. We can discuss this question. So and Mamata, Sreshta, Rajiv. So Urmila, try to write Sreshta. So Pujita, Lucky, try to write your answers in the chat box. So it is useful for you only. So that if you, whatever it is, if you do practically, you can remember. If you don't have the CPT book, just you can enter in the Google also, you can find the answer. So if you know the description, that's enough, na? So write in the Google also if you want. Yeah, thank you, Mamata. So here we will find the keywords first. A 58-year-old male sees his primary care physician. So this is the one keyword. Complaining of fever with chills, cough, and congestion. The physician performed. So here physician performed. Yeah, correct. So a chest X-ray taking lateral and AP views. So here in chest X-rays, views plays very important role. So we need to consider views as a keyword while coding chest X-rays. So the physician interprets the X-ray views and the patient is diagnosed with walking pneumonia. Which CPT code is reported for the chest X-ray performed in the office and interpreted by the physician. So basically here AP view means anterior posterior view in his office. So we will check 71020 first. So what is 71020? One second. 71020. I think we don't have these codes. Only we have 71046. So those are all outdated codes. So based on our scenario, physician has performed two views, lateral and anteroposterior, and even physician performed and interpreted this X-ray in his office. So we no need to code 26 modifier here. So we need to code only 71046. If the chest X-ray is performed somewhere and if the physician interprets that chest X-ray, we need to append 26 modifier. But this chest X-ray physician was performed in his office, so there is no need for 26 modifier here. Yeah, you are correct, Parimila. All are deleted codes, so no need to worry. So our answer is 71046. Yeah, correct. Most of the people wrote correct answer. So guys, try this one. So now it is. So guys, if you are writing CPC, so you need to identify the code little bit fast. Why means I think mostly you have 2 minutes 40 seconds for each question. So you need to do little bit fast. So read the third question and try to find the answer. You will discuss answer at 9:35. Yeah, you have 2 more minutes. So if anyone needs more time, please let me know. So we will discuss the answer here. So the patient has localized prostate cancer, so which is medical necessity, and has chosen to have complete transrectal ultrasonography, okay, performed for dosimetry purposes. So in order to treat prostate cancer, they will use dosimetry. Following calculation of the planned transrectal ultrasound guidance was provided for percutaneous placement of 125 seats. Select the appropriate code for this procedure. So we will check 55920 first. So what is 55920? So placement of needles or catheter into pelvic organs and or genitalia. So except prostate. So basically 55920 is for same procedure but not for prostate gland. So 55920 is wrong. So we can't code that one. So we will check 55860. So we need to remember that for door C, this seats placement, we have one code for prostate, one code for except prostate. So exposure of prostate, any approach for insertion of radioactive substance. So this is also wrong. Why means clearly here physician mentioned it is a percutaneous placement. So we need to check remaining two answers also. So we will check 55876. So placement of interstitial device for radiation therapy guidance, fiducial markers, dosimeter, prostate, single or multiple. So we will compare 76 and 75. So transperineal placement of needles or catheter into prostate for interstitial radio element application with or without cystoscopy. So basically here physician has performed transrectal. So it is directly related to transperineal approach. So here our answer is 55875, and if you check 55875, we have one guidance for ultrasonic guidance for interstitial radio element application, use 76965. So because of this rationale, our answer is D. 55875 percutaneous placement and 76965 for ultrasonic guidance based on the guidance provided in the CPT book. So check this question now. Hi Akash, good evening. Yes, Akash. So we have 2 days back one session started. So if you wish, you can join now. So our team member will teach you those 2 classes, whatever we have missed. So here basically, so we'll discuss last, Mamata. We will discuss at the last. So try for fourth question. So if you don't understand, just watch your live session. After the session also, you can try to understand. And after that also, if you are not understand, you can ask in the next week session. So I think time in the evening, 7 to 8:30. Yes. First here you have two options. So we will discuss the answer now. So we have 2 more minutes. So whatever it is, just write in the chat box so that you will get the confidence. No need to worry about the answer. So we will discuss now. One second, guys. Software problem from my side. Yeah, good guys. Keep it up. So here we have two options in order to find the correct answer. So whether if you have competency with CPT, you can using the CPT you can find the answer. So if you are confident with ICD, you can find the answer with ICD. So as so so I think yeah we can discuss the answer now, Sonal. No problems. So we will check first the question. A 36-year-old male had a ground level fall when he tripped over his dog earlier this evening in his apartment. Okay. The emergency department took X-ray of the left wrist in oblique and lateral views. So we have two views here which reveal a displaced distal radius fracture type 1 open left wrist. So as we all of us know, we need to code for ICD as well as the CPT here. So as usual, we will try with CPT. So we will check 73100 first. So what is 73100? Radiologic examination wrist two views. So 73100 per wrist examination two views. So we will check 73110. So 73110 completely wrong. Why means it is of minimum three views. So we will check 73115. So 73115 is for radiological examination, wrist, arthrography, radiological supervision and intervention. But as per the question, we don't have any arthrography. So we can't select 73115. So we are left with two options here now. So one is A and one is D. So here CPT code is same in A and D. So we need to find answer using ICD code here. So based on our scenario, our code is S52502B. So this is the correct answer. So 502B is for type 1 open left wrist fracture. So yeah, Sonal, you need to here they did not mention any arthrography, na Sonal. So we can't use 73115. So if they mentioned arthrography, we can use 73115, but they did not mention any arthrography. So we can't code C. So and 110 is for three views, but based on our scenario, we have only two views. Yeah, answer A is correct. So here both CPTs are same, but there is a difference in the ICD code. So we that time we need to find difference between ICD codes here. Here 602, here 502. So 502 leads to displaced distal radius fracture type 1 open left wrist. Okay. Yeah, good. So this is fifth question. Try this one. Just here we no need to do more hard work. Just we need to compare. So now it is 951. We discuss our answer at 954. So you no need to worry about the answer. Just to write whatever you know so that you can learn. Yeah, thank you, Gaurav. So yesterday we have published one video, step by step integumentary system coding. Please watch that video. So you will get key secrets in the integumentary system coding if you are working with CPT. So if we have book with you, we can do fast. So just to, no need to worry about the answer. Just to write whatever you know here. So we all are here to learn. So no need to worry. Thank you, Sreshta. So we will check the question here. ACT. So CT means computed tomography density study is performed on a post-menopausal female to screen for osteoporosis. So this is the keyword for medical necessity. Today's visit, the bone density study will be performed on the spine. So here they are going to find osteoporosis on the spine area as patient is postmenopausal. So we have first code, we will check 72081. What is 72081? Radiologic examination, spine, entire thoracic and lumbar including skull, cervical and sacral spine if performed. So that is wrong here. So it is entire thoracic and lumbar. So that is not correct. So we will eliminate 72081. So based on our description, this is wrong. And also there are no views in this question. So but 72081 is one view. So we will check remaining codes. So what is next? 77080. So 80 is for computed tomography bone mineral density study, one or more sites, axial skeleton. So this is also, this is correct. 77078 is correct. So if you check 80, dual energy X-ray absorption study, DXA. But here physician did not do DXA. So they need to mention I have performed DXA in the document in order to code 77080. So what is 77075? Radiological examination osseous survey complete. So this is not osseous survey. If it is osseous survey, physician needs to mention this is osseous study. So if we compare 77078 with our question, computed tomography bone mineral density study, one or more sites, axial skeleton, example, hips, pelvis and spine. So based on the location mentioned in the question, physician is performing bone density on the spine. So our answer is 77078. So here keywords are bone density study and as well as the spine. So those two keywords are mentioned in 77078. So we will check 80. No, we have two types. So 7780 is correct bone density study, but the thing is that as I told you before, it is using dual energy X-ray absorptiometry, but which is not occurred in our scenario. So clearly they have mentioned CT density study. So because of that reason, 77078 is correct. You see, computed tomography means CT. So either 77080 is DXA. So we need to select CT, not DXA. Yeah, that is correct. Based on approach or imaging also we need to code. So 77078 we have CT guided now. So see here CT. So in 77078 also we have CT. So we need to check click 77078 is the answer. We need to select 77078, but 7780 is 77080 is DXA. But as per our scenario, DXA physician did not perform DXA. Physician used only CT, not DXA. So 77078 is the answer. So which is option C. So you got Parmela? So you need to see the imaging also here. 80 is DXA, 78 is CT. So based on our question, we have CT density. So we need to select 77078, which is C. C is the answer. So no worries. So guys, choose this one, sixth question. So now it is 2201. We'll discuss answer at 2205. So if you forget to click on like button, please click now. So it will motivate me, and also I will show interest to create more sessions like this. So click on the like button once. So in radiology, imaging very plays very important role. So we need to be cautious. So thank you, Sandhya. Thanks for visiting Passport 21. So click on like button in order to motivate us so that we can provide more useful sessions. So you no need to worry about answer. Just whatever you know, just mention in the comment chat box so that we can discuss correct answer. So you have 1 more minute. Yeah, thank you, Sreshta. You guys are doing forensic job. So you are acting like a forensic scientist. So we will discuss the answer now. So the patient is a 16 weeks pregnant. In radiology, weeks of gestation is also very important. So we can choose this as one keyword, and with the twins. So this is also one keyword, and coming back. So whenever we see coming back means this is a follow up. So patient is coming for second time. So that's why here we have the word coming back to her obstetrician to have a trans-abdominal ultrasound. So this is also one keyword. Perform to reassess anatomic. Reassess means second time physician is assessing anatomic abnormalities of both fetus. So this is also one keyword that were previously demonstrated. So this is also one keyword. Previously means second time patient is coming in the last ultrasound. So what ultrasound code is reported? So we will check first 76081. So what is 81? Ultrasound, pregnant uterus, real time with image documentation, fetal and maternal evaluation, first trimester. So directly we can eliminate 76801 as it is related to less than 14 weeks. So but based on our scenario, we have 16 weeks pregnant. So we can eliminate 76801 now. We will check 76805. So ultrasound pregnant uterus, real time with image documentation, fetal and maternal evaluation after first trimester, trans-abdominal approach, singular first gestation. But this is little bit correct. 50% answer is correct, but we can't choose this answer. We need to select or check remaining A and B also. So what is 157615 ultrasound pregnant uterus real time with image documentation limited one or more fetuses, and what is 16 ultrasound pregnant uterus real time with image documentation. So as per our question, patient is coming back. So it is a follow-up examination. So patient has previous study. In the study, physician found some abnormality, and this time patient came back to physician in order to check again. So based on our keyword 76816 contains follow-up. So because that our 7618 76816 is the correct answer. And if you check guidelines here in the CPT book, report 76816 with modifier 59 for each additional fetus examined in a multiple pregnancy. So as all of us know, we have both fetus means two fetus. So one fetus we will code 76816, and one more fetus we need to code 76816 with 59. For example, if we have three fetus, we will code once again 76816 with 59 modifier. So I hope everyone got this answer. Yeah, yeah. Correct, Srinath. Santosh, welcome to Fast Coder 21. Yeah, your answer is correct. So you need to, so while writing CPC or while doing surgery coding, we need to check the guidelines related to CPT code and above and down so that we can code properly. So guys, check these answers. Seventh one. So now it is 10:08. We will check the answer at 10:12. So guys, if you are anyone don't understand this session in this session, you can watch this session after recording so that you might be get or understand this answer at that time. So you no need to get panic. You have option to watch this session after completion of this session. So if you don't understand now, you can watch again and learn. So just try to find the keyword. If you know appropriate keywords, we can code easily. Yeah, correct, Panamara. You are doing good. Keep it up. So, Paramila, watch yesterday's session. I hope you have watched complete session. So next week we are going to create one video for step by step. So we are going to create this series, step by step series like that. So yesterday we have published first session for integumentary. We have multiple sessions in integumentary system. So next week we are going to publish ortho musculoskeletal system. So 20,000 series. So you guys have 1 more minute. So in CPT, whether it is CPC exam or whether it is surgery coding, whenever we read the operating report, we need to find the keywords and approach. If you know properly how to find the keyword and approach, we can code easily. So we can discuss the answer here. So a 22-year-old pregnant female has gestational diabetes at 34 weeks gestation. Okay. Her doctor is concerned about decreased fetal movement. Okay. The patient is sent to the radiology department of the hospital for biophysical profile. So this is the keyword here. The radiologist performs and interprets four elements scored by the ultrasound. So we need to make it as keyword ultrasound, and it was reassuring 8 out of 8. Okay, fine. A non-stress test will be performed by the obstetrician at the patient's next office visit, not the radiologist. What is the correct CPT code for the fetal profile performed by the radiologist? So most of the people wrote correct answer, which is 76819. So we will check 76815 first. So what is 15? Ultrasound pregnant uterus real time with image documentation limited. So 15 is wrong, but there is no biophysical profile mentioned in the code. So 15 is wrong. So we will check 18 now. So fetal biophysical profile with non-stress testing, but based on our scenario, physician did not mention any stress testing, so we need to consider it as stress testing. So here our answer is 76819. So you may get confused here. So we need to select 76819 without non-stress testing. So 76820 is Doppler velocimetry, which is not performed by the physician. So because of this rationale, our answer is 76819. Yeah, most of the guys wrote correct answer. No worries. So next one. Sanjay, our answer is C, 76819. So 180 is for with non-stress testing, but physician did not mention any related to stress testing. Na? So we need to code without non-stress testing. So as a coding rule, the physician mentions we need to code. The physician did not mention means without. So find this answer. Question number 8. So now it is 10:15. We will discuss the answer at 10:19. So you don't need to about the answer whether it is correct or wrong. Yes, Parmila, you are rocking. So you are again started your intelligence. You are doing good. So basically, eighth question will comes under interventional radiology. So just whenever physician use procedure as well as physician will use radiology, we need to consider it as interventional radiology. So intervention means an procedure, radiology means radiology code. So in order to accomplish any procedure, physician will use radiology. So those procedures we will call interventional radiology. Basically, these procedures are performed on the vascular system. So like arteries and veins. Mostly IVR procedures performed on the blood vessels. So we have 2 more minutes. So we will discuss the answer now. The physician performs selective catheterization of the right renal artery. So good. And renal angiography. The puncture site was the right femoral artery. So basically, in order to code this question, we need to understand what is selective catheterization and non-selective catheterization. So basically, selective means physician is choosing artery to do the procedure. So, but non-selective means so physician will use catheter and also physician will keep the catheter in the aorta. If the physician keeps catheter in the aorta, which is non-selective. So if the physician crosses the aorta and if he goes to the other branches, we will call it as selective. So physician stops at aorta, we can consider non-selective. If physician crosses aorta, we can consider selective. So here physician had done selective catheterization. So right renal artery and renal angiography. So we will check the one by one codes here. We will first check 36215. So selective catheter placement arterial system, each first order thoracic or brachiocephalic branch. But based on our scenario, physician has performed catheterization on renal artery. So we will eliminate 36215 here. We will check 36245. So 1 minute, I am going down. What is that? 36245. Yeah, what is 245? Selective catheter placement arterial system, each first order abdominal, pelvic or lower extremity artery branch within a vascular family. So basically 245 is for lower extremity, but here physician has did not do any procedure on lower extremity artery. So we can eliminate 36245. So we are left with A and D. So here based on the IVR guidelines, access code we need to code 36251. 1 minute. So if you check 36251, it includes selective catheter placement first order. So after the aorta, we will get first order main renal artery and accessory renal artery for renal angiography, including arterial puncture and catheter placement, fluoroscopy, contrast injection, image post processing, permanent recording of images, and radiological supervision and interpretation, including pressure gradient measurements when performed, and plus aortogram when performed unilateral. So physician has performed here unilateral procedure, and femoral artery puncture site all are included in the 36251. So we no need to code separately 36200 and 75625 here. So those radiology procedure and access both are included in 36251. So that's why our answer is D. So we can't do unbundling in radiology course. All this information included in 36251. So we can't do unbundling. This is unbundling here. So we can't do unbundling. So our answer is 36251. So most of the people wrote correct answer only. Good job. So last question of the day. So now it is 10:23. We can discuss the answer at 10:26. So you try to write the, yeah, good Parmila. I think you are practicing well at your end. You are doing good job. So like that only you need to follow the guidelines. So whenever you code, you need to check the section guidelines. So if you know the section guidelines, we can code easily. Usually we'll call it as subsection guidelines. Yeah, good Gaurav. Keep it up. Thank you, Sreshta. So you guys no need to worry if you don't understand any question in this session. Please watch our live session recording afterwards. Tomorrow you can watch. Today you can't watch. So you can try to clear your doubt. So if you don't understand in this session, no need to get panic. Try to watch the session tomorrow again. So you guys are having 1 more minute. Yeah, we can discuss the answer here. So a patient with colon cancer, so this is the medical necessity, receives 5 sessions of radiation treatment. So this is very important keyword here. During the course of treatments, the physician views the port films, reviews the treatment parameters, and assess the patient's response to the treatment. So the patient receives 2 more treatment sessions when ending the course of treatment. So total here 5 plus 2, total 7. So code the CPT code for the radiation treatment management. So anyway, we have only 2 options here. We can check 2. So basically, we will check 7431 first. So 7431 is for 1 or 2 fractions. So, but we have 7. So directly we can eliminate 77431. So we are left with 77427. So if you check CPT book guidelines, code 77427 is also reported if there are 3 or 4 fractions beyond a multiple of 5 at the end of a course of treatment, 1 or 2 fractions beyond a multiple of 5 at the end of a course of treatment are not reported separately. So we have total 7 treatments here. But based on the CPT book guideline, they are telling that so more than 1 or 2 after 5 treatments, we need to code only 77427. So we no need to code remaining 2 treatments. So based on the CPT guideline. So using that guideline, our answer is 77427. Yeah, 5 treatment. So after 5 treatment, we have 1 or 2 also. We no need to code direct. Yeah, that is correct answer, Gaurav. So after 5 treatment, if we have 6 or 7, we no need to code separately those remaining 2. That is based on the CPT guideline, not our guideline. So they are telling that you no need to code remaining 2 treatments. So guys, so today we have completed our session. Happy coding. So we will wait for 5 more minutes. If you have any general doubt, you can mention in the chat box. I hope you all are guys in our WhatsApp group or Telegram groups. So if anyone is not in that WhatsApp or Telegram groups, join now so that you can get latest updates. So if you have any concern, please mention in the comment section or otherwise just write in the chat box here. Tomorrow nahi hai Gaurav. Tomorrow weekday hai na. Next week Saturday, Sunday again. So surely this time we will mention one cardiology section. Saturday or tomorrow Sunday we will have one cardiology scenarios. So now it is 10:29. I will stop the session at 10:35. Meanwhile, if you have any doubt, you can mention in the chat box. So if you don't understand this session, watch this session again tomorrow so you can clear all your confusion. So there is no restrictions. Number of times you can see this session afterwards. So as long as you don't understand, you can watch again and again. Yeah, surely we will have one session E&M next week or afterwards. Surely we will have one session for E&M. So we will try to run those topics. Cardiology, either E&M. So no need to worry. So if anyone did not join in our WhatsApp groups, join now. I am posting the link in the chat box. So anyone can join now and also share this link to your friends. So your friends will be get beneficial using our channel. So try to encourage your friends to subscribe to our channel. Currently we have 4,246 subscribers. So we have sessions related to outpatient, inpatient, denials, IVR, denial management, anesthesia coding, all types of videos we have. So encourage your friends to join in our WhatsApp group and subscribe to our channel. So if anyone wants to join, just click on that WhatsApp link. You can join directly. If you are already in the WhatsApp groups, no need to worry. If any new people are there, you can join now. So you have 2 more minutes left. So Parmila, do you have any doubt? And Gaurav, I think mostly next week we will have one session related to cardiology, surely. And Shrestha, I will try to conduct one session related to E&M. So one session E&M, one session cardiology. I will plan like that. No need to worry. And if you want anatomy, we have few videos related to E&M. Yeah. That is basically one mock test. So basically, the reason here is some cardiology procedures needs interventional radiology needs cardiology radiology codes. That's why they have mentioned this in radiology section. So basically you need to understand that cardiology and interventional radiology both are interrelated. Total cardiology codes are depends on radiology if they are doing a vascular surgery. So that's why they have mentioned cardiology question in interventional radiology, this radiology session. But here we need to understand the guideline. So that is the main thing we need to understand. So based on guideline 36251 includes radiology also. So we no need to code separately. So that is the thing we need to understand. So good night, guys. So if you have any concerns, send your concern to Vincent Medical Coder @ gmail.com so that I can try to help you. So our email ID is vincentmedicalcoder @gmail.com. So you can send your concerns to gmail.com so that. So what is that, Lucky? C is for which answer? So thank you, guys. I am stopping the session now. Thanks and thank you very much for your valuable time. We will meet you on next week. So we will plan E&M and cardiology. No worries. Thank you, Gaurav. We will do next week cardiology, and Srestha we will do E&M next week. Bye, guys. Thank you.